Well, I think the Affordable Care Act is going to be important because many patients that are underinsured or frankly uninsured will now have an option to get insurance. I think one of the challenges will be, and this is important for your audience, is seeing what kind of coverage those people that are now going to be under this new plan, the new plans, what coverage are they going to have? What options in terms of medications? Is it going to be limited in what's on the formulary? So this is going to be very important. Right now, the people that are uninsured, generally the pharmaceutical companies will provide free medication to those patients. So many of the companies are underwriting millions of dollars worth of medications for those patients, so they do get access. However, there's many patients out there that don't know about that, and because they're undercovered, they don't have any insurance coverage, they're not going to the doctor because they don't realize that they can get help with their medication. So it will allow more people to come into the system. I think ultimately we're going to get better results. I mean, we can see that patients that adhere to the medications, stay on their medications, do so much better long-term in terms of the disease and preventing disability. Well, I think that's always been really the goal, is trying to find medications that are going to improve the standard of living of people living with MS. And specifically, that's in MS, one of the biggest drivers is disability. So that's clearly been a major outcome in our clinical trials. Most of the clinical trials that do focus on physical disability, a lot of our patients have cognitive issues, so there was a session on cognitive, trying to work on cognitive issues with MS. But we do look at those patient-centric outcomes, preventing the relapses that are very disruptive in their life, and then also looking at quality of life outcome measures and looking at fatigue status scales. So fatigue is 90% of our patients with MS have fatigue. So ways that we can kind of help with that, symptomatic management and decreasing those outcomes.